When it comes to the fight against breast cancer, early detection is vital. And this morning, Dr. Tom Rogers from Performance Medicine discusses the importance of mammograms and self-examination in detecting breast cancer as early as possible.
Thanks. It's great to be here today. We're going to talk about breast cancer today. As you know, October is Breast Cancer Awareness Month, and I have a special guest, Betty, today, who's a longtime RN that actually works with me and doing a lot of my IV therapies. But in my opinion, we need to get a lot of mammograms. I know there's a lot of controversy about mammograms and all, but I think they're life-saving. And we'll talk to Betty a little bit about how she discovered her breast cancer. I believe it's been about 6 years since you had the diagnosis and got surgery and afterwards some treatment. But tell me how you discovered your breast cancer, Betty.
It was interesting because I did have the mammogram. I had my mammograms like I should have, but the way it was discovered was when I got out of the shower and looked, I noticed a dimpling of the skin, which is a very telltale sign. And had been doing breast exams, which is very, very important to me. That's one of the more important things, is the self-exams. And actually, though, could not feel anything because it was so deep and the tissue was so dense. So really, by just looking at myself in the mirror when I got out of the shower and looking and seeing the dimpling, that's how it was discovered. And from there on, went to an ultrasound and biopsies and then the surgery.
That's very interesting that you discovered this breast cancer on your own.
Exactly.
Now, you're a nurse and probably a little more educated. You've seen a lot of things in your lifetime.
Right.
And I do believe in mammograms. I think a lot of times a mammogram will see something that there's no way it's visible.
Right.
So I'm a big believer in yearly mammograms, starting at an early age. I really recommend that women get them a baseline at age 30, and if nothing to worry about, then for sure by 40. Right. And I like annual. I know that kind of that's more frequent and a lot of people like it, but I think it's very, very necessary.
Right.
My cousin is a breast cancer surgeon in Little Rock, Arkansas, and it seems like to me, and that's all she does is breast cancer. And we talk frequently. She told me that she's seen a lot more younger women in their 20s that are coming down with breast cancer. And we sit and talk about maybe what are the causes of that. She thinks, in her opinion, that it is dietary. You know, we eat such poor diets nowadays that the rates are increasing. But I do want to emphasize that it's very important to get screening with your doctor, get mammograms, do self-checks, look at yourself, get a doctor or nurse to teach you how to do self-breast exam. Tell me subsequently how you did after the surgery, and obviously you've done great.
Excuse me. I did really well after the surgery. I opted for a bilateral mastectomy. Didn't have the reconstruction. That was my choice on that. At 68 years of age, opted not to have that, but did well. Was only away from work for 3 weeks, and took high doses of vitamin C, and no chemo, no radiation, and the high doses of vitamin C actually saved my life.
Interesting. Interesting.
That it to me is just a really, really, but the prevention to me with this type of deal, prevention is your best medicine.
Thank you so much for being so open with us, and obviously you're doing fantastic, and
Feel well.
You look great. Please, if you're a woman, think about getting a mammogram, doing a self-breast exam, and following up with your doctor.
The preceding portion of Daytime was sponsored by